Well, hello everybody. My name is Khoa, lecturer of anatomy, physiology, and medical terminology. And today we are going to draw out and look at the tributaries for the coronary venous system of the heart. So before we are going to start drawing out the branches and tributaries of the coronary venous system, I'm going to have a couple of disclaimers for you. Disclaimer number one, I'm going to try and draw as slow as possible so that we can all follow each other. And you can follow me as I draw out these tributaries of the coronary venous system. However, if you ever found that my speed of drawing is a little bit too fast, you can always pause the video, catch up with me, and then we can continue on forward together. Okay. Disclaimer number two is that anatomical variation exists. And even though I'm trying to cover the most common pattern, you will find that the pattern that we're going to draw here today is not going to be true for all of the patients. So please check your patient carefully before you proceed in a clinical setting. Okay. And the third one is that today we are going to use two types of pens. The first type of pen is a black pen. And this black pen is going to be used for drawing the structures of the heart. Okay. So the black pens are for structure of heart. And now we're going to also need a blue pen. This blue pen is going to be the structure of the coronary venous system. And all right, with all these three disclaimers out of the way, let us get started. So just like with the coronary arterial system, we are going to start with the outline on the lateral side of the right atrium over here. And then we will continue that with a horizontal, almost horizontal line down here that represents the edge of the right ventricle. And then after that, we're going to continue it upwards and on the left side with the outline for the left ventricle and the left atrium up here. And now we are going to start adding the major vessels of the heart into the mix. This first one is going to be attached to the right atrium from the superior side, and that would be the superior vena cava. And then we'll draw out the inferior vena cava down here as well. And then after that, we're going to draw a vessel on the anterior surface of the heart that runs diagonally on the surface, and that will be the pulmonary trunk, and it's going to divide into the right and left pulmonary arteries. Finally, we're going to draw out the aorta. Let's start by drawing out the ascending aorta right here, and then making an arch over here. Okay, and also draw out the three branches of the arc as well, before getting it down to become the thoracic aorta right here. All right, and now let us draw out as well the coronary sulcus, as well as the anterior and posterior interventricular sulci. Okay, so now let's draw the right coronary sulcus over here, the left coronary sulcus over here, as well as continuing the sulcus all the way to the posterior side of the heart, like this. Okay, and now let us draw out the anterior interventricular sulcus right here, as well as extending it all the way to the back and becoming the posterior interventricular sulcus, like this. All right, and now we will switch the pens to a blue pen in order to draw out the coronary venous system. So the first vein that we are going to draw out is going to be this vein right here that courses within the anterior interventricular sulcus. And this vein would be the great cardiac vein. And the great cardiac vein is going to go, first off, like I said, within the anterior interventricular sulcus, and then it's going to course within the left coronary sulcus to the left border of the heart, right there. Okay, and then it's going to go to the posterior side of the heart, like this. Okay, and at this location right here, this vein, the great cardiac vein, is going to join with another vein right here that drains venous blood from the left atrium. Okay, at the back of the heart like this. And this vein right here is called the oblique vein of the left atrium. Okay, and these two, the oblique vein of the left atrium as well as the great cardiac vein, are going to join up to become this structure here at the posterior side of the heart. And this structure is called the coronary sinus. Let's erase this for a second here. So you can think of the coronary sinus as the site where the majority of the veins of the heart is going to dump their deoxygenated blood into. And the coronary sinus is going to have this connection to the right atrium like this. Okay, so this is the right atrium, and this is the opening for the coronary sinus right on the right atrium. Okay, and so venous blood is going to go into the coronary sinus, and the coronary sinus is going to transport this deoxygenated blood to the right atrium. Okay, now connecting to the coronary sinus, besides from the oblique vein, the left atrium, as well as the great cardiac vein, there are also two other veins. Okay, the first one is right here, coursing within the posterior interventricular sulcus, and you call that vein the middle cardiac vein. Okay, and the middle cardiac vein is going to accompany the posterior descending artery, and the great cardiac vein is going to accompany the anterior interventricular artery, or the LAD. All right, and now besides from the middle cardiac vein, you also have another vein from here. Okay, so this vein in this location is going to parallel the right marginal artery. Okay, and it's going to run within the right coronary sulcus, going back to the posterior surface of the heart over here, and eventually into the coronary sinus. All right, and so this vein right here is called the small cardiac vein. All right, and so all of those are the veins that are going to enter into the coronary sinus, and the coronary sinus is going to take the deoxygenated blood from all of those veins and transfer it to the right atrium. But now that's not the end of the story, because some veins, like these anterior cardiac veins right here and right here, they can deposit some venous blood into the right atrium directly without even having to go through the coronary sinus at all. So these guys, they're called the anterior cardiac veins. Okay, and here means anterior. Okay, anterior cardiac veins, and they empty into the right atrium directly. There's also another type of veins that I'm not going to draw here because they're very, very tiny. Okay, that is going to take the blood from some parts of the myocardium and deposit them right into the right atrium. And those veins are going to either be called the smallest cardiac veins or the venae cordis minimae. Okay, and those veins are going to bring deoxygenated blood from the myocardium, some parts of the myocardium, to the right atrium directly without going through the coronary sinus. All right, so those are all the veins of the coronary venous system of the heart. Thank you very much for watching this video. My name is Khoa, and I hope I will see you in the next video drawing other structures in the series Drawing Anatomy with Khoa. If you have any questions, don't hesitate to ask them into the comments so that I may be able to answer them for you. Thank you very much once again, and